Everyone, and welcome to our weekly Wound Care Pro with Nurse Practitioner Anne Walsh series, where we're talking about none other than wound care, all types of wound care. But today, I think we're going to focus a little bit more on the feet. I think we're going to be talking about cleaning your wound. And I would imagine that there are different tools, different techniques to cleaning a wound, depending on whether it's maybe a diabetic wound or whether it's a typical wound, whether a wound is infected. We're going to get into all of that coming up in just a moment, but let's welcome Nurse Practitioner Anne Walsh. Thank you so much for being here every single week. We really appreciate you.
Thank you. Great to be here.
And she is the founder of Wound Care Pro, the app, and it is available on the App Store and in Google Play for $4.99. It's geared towards physicians and clinicians, but we've had several patients download it as well, and they've said that the information there helps them because there's so much cutting edge information, new studies, new tools, new techniques that are all discussed on this app as you try to keep it up to date. So make sure you do download it. Wound Care Pro, just go ahead and look that up on the App Store or on Google Play. So, Anne, why don't we get into it? We're going to be talking about cleaning wounds. We get asked this all the time in our groups for peripheral artery disease. Peripheral artery disease meaning the leg issue where you have restricted blood flow due to plaque buildup. If that blood flow is restricted, you end up with a wound on your foot that won't heal. That's a major problem. And so wound care becomes very important to prevent amputation. So let's start with, Anne, what is the best way to clean a foot or toe wound at home? And does it differ whether or not you're diabetic?
Well, just the cleansing is so important. It's not even just the wound, it's the peri-wound, which means the surrounding tissue. So let's say if you have a wound on your toe, you're not just going to clean the toe. You want to really get the whole foot involved. This way, if anything's brewing in the outskirts of the wound, it's not going to get into the actual wound itself. It's what we're using to clean the wound. We don't want any kind of harsh chemicals like peroxide or rubbing alcohol, something like that, which is not good for an open wound. It's going to kill the healthy cells that are trying to heal that wound. So just what we're using, the technique. I like spray bottles because a lot of times with a wound cleanser, or you can get a spray bottle that you water a plant with that's new. And you put it on spray, so it's not too harsh where you're driving bacteria into the wound or causing pain, but you're giving it a good cleaning.
And so what about gangrene? You probably, I don't know, do you wash
Gangrene's a little different. Yeah, you want to keep those dry because you want to keep it nice, dry environment. We'll paint those with betadine if there's no allergy to sort of keep any bacteria down and keep it dry.
So how often should a patient be cleaning their wounds?
I mean, it depends on what's being used for the actual wound. A lot of these advanced products work up to 7 days. So typically for us, we'll say twice a week and PRN. But if you were prescribed a daily antibiotic ointment, depending on the situation, then you would do that daily. But let's say the honey wound products, the silver products, they actually work up to 7 days. Not saying we're going to get 7 days out of them, depending on how much drainage and where the wound is located. But a lot of times you don't need to do it every day, again, depending on the situation.
What are some of those cleaning solutions that you were talking about that are safe and effective for regular and for diabetic foot wounds? You were saying no alcohol, no peroxide, and I would imagine, and I'm not even making a joke of this, no bleach, because we have some patients in the Philippines that actually we had to stop them from using bleach to clean their wounds.
Yeah, I mean, usually a wound cleanser, the wound cleanser sprays are made where they're non-harsh, non-irritating. Saline, which is just sodium chloride, 0.9%. So just there's nothing harsh about that. When you say bleach, I mean, there are products like Dakin solution that does have a little bleach in it, but it's, if you get the right percentage, like 0.0125%, it's actually non-harsh. So if we had a wound that we were afraid of infection, or maybe there was an odor, we may use something like that to take care of any surface bacteria and go from there, but certainly not regular household bleach, full strength or anything like that.
How can a diabetic in particular tell if their foot wound is becoming infected during the cleaning process? Is that something that they can just tell in general, or is there something that comes out during the cleaning process that would be an indicator that, hey, this wound is infected?
Yeah, I mean, there's a few things. You may see that the wound is bleeding easily, meaning it's irritated, whether it's a full-blown infection or some surface bacteria causing irritation. So why is this wound bleeding all of a sudden? That's a change. You may get an odor from the wound. And we always say when you clean the wound, then you assess for an odor. Because if you're taking off an old dressing, may have a little bit of, the hot weather, is a little bit of, characteristic smell. Clean the wound, get the old dressing out of the way, and then do I still have an odor? And you may see edema, redness. You may feel like a firmness around the wound. And these are all changes that you hadn't seen before, or it may feel hotter. You may have a temperature, or the foot itself may feel warmer, and you may notice your sugar going up. It's like, why is this going up? I'm not doing anything different. Could be infections brewing somewhere, whether it's, the urine or, somewhere else, but you want to look at that wound and make sure that's not the source.
So what signs should diabetics actually look for during wound cleaning that would indicate they do need to seek professional help? Like, it's one thing to say, well, it's a little infected or whatever, but at what point, what is that indicator? Of course, if you think you're having a medical emergency, you think there's a problem, always call the doctor. But can you give us at least a few clear indicators?
Yeah, I think when you have diabetes, you have to be extra cautious. So if all of a sudden you're noticing there's an odor, the drainage seems more purulent, so it's thicker, maybe green, yellow color, wouldn't hurt to reach out to your provider to get it looked at to make sure we're catching it early in case anything is brewing. And again, any tenderness, that's something new, or firmness, or swelling, or erythema, any kind of redness, you want to get that checked. You don't want to let that go. And again, if your sugar's creeping up and the wound is starting to bleed, just to keep on top of it, they may change the topical wound care or have you come in and get a better look at it to make sure.
So we talked about the, no alcohol, no peroxide. Are there any other cleaning techniques or any products that diabetics should avoid, or any patient that has a wound that they're trying to care for that won't heal or is slow to heal, that they should avoid when treating their wounds?
Yeah, any harsh antiseptics, like I said, the peroxide, you don't want to use betadine on a good, healthy, open wound, those kinds of things. The wound cleansers, saline, sometimes even plain soap and water, depending if you're using a, non-irritating soap, may be okay, depending if the wound is superficial and there's no signs of infection, and, you can keep on top of it. So just avoiding anything that's perfumed or has harsh chemicals in it, that's really not for an open, healthy wound.
Magic must have a sterile environment. Can you offer some tips on how they can maintain a sterile environment while cleaning their foot wounds at home?
Yeah, well, in the home, it's really a clean technique. Only ones that really need sterile, let's say if it's your post-surgery for the early period, then you want sterile gauze and everything's more sterile. Once you get past that period, these wounds they're chronic. It's a clean technique. They're not sterile by no means. So, as long as you're washing your hands, you're putting the clean gloves on, you're putting clean supplies. Try to keep an area separated so any pets in the home and that sort of thing aren't getting into your supplies. Put them in a Ziploc bag. Just keeping that clean environment. Again, hand washing is critical, and keeping all your supplies separated from other things. I've gone to patients' houses and the gauze is half open and they'll go to reach for that and it's been sitting there. You really want to keep it separate and keep it organized. But again, it's a clean technique. Hand washing is critical.
Um, is there anything that I missed, in what I was asking, about the supplies and things like that? Because I'm still having trouble wrapping my head around, just the so you have your spray bottle and you're spraying the wound. I would imagine you'd have to have a specific gauze. You'd have to have, do you have a towel? Do you dab it? You don't rub it, I would imagine.
Yeah, I mean, you have gauze in the home, and again, it could be clean versus sterile gauze. I know Diana asked a question about that, where each gauze is individually, it's sterile piece. You don't necessarily need that in the home. We get the packets of non-woven, non-sterile gauze. It's clean, big packet. So you want to have all that laid out. You have your gloves on. You take the old dressing off. You want to have your hands washed. Put a fresh pair of gloves on to do the wound care. So you're not touching everything. You're going to spray that wound. Perhaps have a chuck on the floor and a basin to catch, what you're irrigating. And then you get the gauze, dry it, pat it dry, and you proceed with the dressing that's been ordered. You'll change the gloves again, and then maybe if it's a hydrogel or honey, have everything kind of lined up and put that on without, like I said, touching everything. And you want to wrap the wound well and put the gauze that's not going to stick to the wound on. And again, the dressing is going to depend on what are we seeing? How much drainage is there? Is the wound in need of debridement, or do we need a debriding agent? So all that's going to be determined by your healthcare provider, depending on what we see with the wound, and you'll be taught the wound care technique.
Diana was asking, and I don't know if Diane wants to jump on herself, but she was asking here in the live studio audience, when to use which dressing, the pros and the cons of. She has this list of 5 different ones, from Purad oil emulsion dressings to collagen wound dressings to collagen matrix with ORC and silver to Mepilex AG antimicrobial foam dressing. I mean, there's just quite a few of them there. That would make it really hard. You're sitting there in the aisle going, or on Amazon going, I have no idea which to choose.
It is. And again, you're looking at the wound. If the wound has necrotic tissue in need of debridement, then, if you're hopefully getting a wound consult, then maybe the honey products are going to clean that wound up for you, depending on how much drainage. If you got all those pieces in place, the wound is clean, your sugar's in good, standing, and you're eating well, good nutrition, and the wound is still not healing, that's when you got to look at these other products, the collagens, the silver dressings. So that's not your first go-to. You're doing sort of basic wound care, good cleaning, and keeping the wound bed moist, but not too moist. And again, controlling these other factors that impede the wound healing. Get the pressure off that wound, get the sugar under control, stop smoking if you smoke, those are kind of things that really, and then if you still say, hey, this wound is not going anywhere, then we sort of bring in the big guns, collagen dressings, silver dressings, and that sort of thing.
And she asks, when is it okay to use non-sterilized gauze, and when is it not okay to use non-sterilized gauze? And she says the entire time she was on a wound evac, the nurse used non-sterilized gauze, the ones that come in bulk, not individually wrapped. And with her last amputation, she's also been using non-individually wrapped gauze.
Yeah, so typically they found that the infection rate does not go up with using clean versus sterile in the typical wound scenario. Again, fresh post-op, if somebody had some kind of surgery, for those, until the surgeon checks it and you sort of pass that inspection, that's when you're using sterile. After that, for the most part, with these chronic wounds, they're not a sterile environment. You want to keep it clean and hopefully, not have excess bacteria in there, but a clean technique with those type of gauze Diana spoke about are fine during that process.
I don't know, Diana, did she answer your questions about those? And do you want to come in and ask your other questions that you have listed?
Yeah, thank you for answering that. I guess a question just kind of came up is, if I still have a wet or open wound, with how thin the skin can become on the feet, why wouldn't we kind of go to the collagen wound dressings?
Yeah, it's just that it's not the first go-to if you've had this wound for a while, it may be in your case. But if, let's say, your sugar's not under control and all these other factors are going on, if the wound needed to be debrided, for example, then use a collagen dressing, it's not going to do anything, and then it's may cost you, let's say, because a higher cost for those products. So you sort of want to use them in the right position. I've had patients where I've used it, we've tried everything else, person's healing beautifully, and then all of a sudden it sort of stops and the healing stalls. And it's like, okay, we went from 10 by whatever 10, and now it's 2 by 2, but it's staying there. And those patients, I was like, let's back up. How's her appetite? Is she still eating okay? And what have you? Everything seems to be baseline. Let's bring in the collagen dressings then, so it's just the right timing for it, I think. It's not going to hurt you, but it just may not give you those results if these other things haven't been addressed that are more critical to wound healing.
Okay. And then when do you would someone use Santel?
Well, Santel is a debriding agent. So if there's a wound that has necrotic tissue that, debridement is the goal, then Santel would help with that. It's an ointment that has to be done 1-2 times a day, and it'll help debride depending on the situation.
And when would something like Santel be more effective than like someone scraping off the the doctor scraping off um the wound, the
Yeah, I
debris?
mean, it depends how much is there. Sometimes you use a combination. Some patients will
Mm-hmm.
come to us and there's a lot of necrotic tissue. It would take Santel forever to penetrate that and clean that up. So doing a bedside debridement is a quick way to clean up most of it, but sometimes you really can't get it all. And then you may supplement in between the visits to the provider to
Mm-hmm.
debride. So in that sort of situation, so it depends, if there's a little bit, of necrotic tissue, that's fine. But if there's a lot, you really want the sharp debridement to get that out of
Mm-hmm.
there, and then have the assistance of Santel or the honey products to finish it off.
Is it
Got it.
possible, we the daughter of the patient that messaged in, and she said um, they ran out of their Santel and they're having a difficult time sourcing it, and they're really concerned. Um, she says her prescription goes by wound size, and they said she would need 35 tubes a month, and they won't half the amount since the wound is large and must go by the size. And she said she can't even pay for the copay, and she wondered if there's anything that she can do. Is Santel the only thing that's going to work, or is there something else that would be more cost effective and even over the counter that they could get?
Yeah, so depending on the wound and how much necrotic tissue, if it's a large wound, I wouldn't necessarily think Santel because it's going to cost a lot of money to get, so I look at the size of the wound, how much necrotic tissue, what are we dealing with? So we actually have excellent success with Dakin's solution on larger wounds. But again, I don't know her particular type of wound or how much necrotic tissue, but we use the 0.0125%. It's not going to hurt the good tissue. And, you put it on a gauze or a Curlex and cover a large wound. And we'll even do 3 times a week in PRN and cleans the wound up, and then we move on to something else. Or if it's a smaller wound, I may look at the honey products or Santel. So you're looking at how much necrotic tissue we're trying to clean up and what's the size of the wound. But yeah, no, Santel would it would take a lot if it's a very large wound.
And Diana, did she answer your questions for the ointments? I know that you also were asking for ointments, Neosporin and muciprocin. I don't know if I pronounced that right.
Yeah.
Yeah, I mean, the Neosporin's over the counter, so if it's a
Mhm.
minor wound, it may be okay. Some people get, sensitive to it. A lot of patients, they have little cuts and scrapes, they'll use it and they seem to tolerate it well. The mupirocin, or Bactroban is the other name, that's a prescription item, so it's stronger. So if somebody was fearing MRSA in the wound or something along those lines, and they want to bring out, the bigger guns, then the mupirocin prescription can be sent to the pharmacy, and usually it's done twice a day or so, depending on the situation. Again, if
And what
it's the big, huge wound, you would go through a lot of that too. So that's why a lot of these factors come into it. Like, what's the best case to address your particular wound?
and what would you look for Nuka Honey? We hear that all the time, medicinal honey. What do you look for when you're on Amazon or you're walking into the store, or is this something that you need to get prescription for to get the right one? I mean, obviously you can't just go to the store and go to the honey section and get Manuka honey from New Zealand and say, oh, there it is, I'm going to use this on my wound. What is the difference? What do you look for in choosing the right medicinal honey?
Well, any of the wounds supply stores or Amazon will have a medical grade honey. So you just pick the company. Medline has one, Smith and Nephew has one. A lot of the companies have them. So I'm not saying which one is better than the other ones. They're all medical grade. They're all been sterilized Manuka honey. So any of those, whatever is more cost effective for you. You're not getting not getting from the grocery store, like you said. But again, Medline, Smith and Nephew, there's a bunch more now. Everyone's on the honey bandwagon. It's a good product. So in the right situation.
Diana, did you have other questions about the wound wash agents?
Yeah, this question that came in from the other person, you were talking about the daughter. When you said Dakin's versus the saline, not saline, versus Santel versus the honey, are you using the Dakin's just more than just a wound wash agent, right?
Yes. So if I have a large wound, a lot of times pressure injuries, they may be quite large, have a lot of necrotic tissue. We may debride some at the bedside, and there's still a lot there. So with that, I'm not thinking honey or Santel because it would take tubes and tubes to, deal with this. So I'll use the Dakin solution, pour it on the gauze, usually non-woven gauze, so it doesn't stick. Or if it's a large wound, Curlex, like a Curlex wrap that you would wrap a leg wound with, if it's that large. Put it on that, squeeze it out where it's moistened with that, and put that on the wound. And that usually cleans up a wound rather quickly, takes care of the odor. And once it's cleaner, then we stand back and say, okay, now how much drainage is there? Do I need an alginate for heavier drainage, or do I need hydrogel for more, lesser drainage? So it's sort of like you're going with the flow of the wound. What am I looking at? What are the characteristics? And what's my goal here?
Got it. Okay, thank you.
So if you're on Amazon, whatever, and you're looking for a saline solution, any tips or tricks for making sure you're getting the right one of the?
I mean, not really. I mean, they all have. I don't particularly like there's a spray bottle. It's almost like aerosol. I find like it comes out with such force. So I forget the company name, but for me, I find if I'm trying to clean it, the patient's like, whoa, it comes flying out. But basically, any 0.9% sodium chloride solution you could purchase, they're all good. Sometimes you get the bottle, you can put it in a spray bottle yourself, so you could put it on spray versus stream. So you're cleaning the wound without being too harsh.
Fantastic. And you had some wounds. I didn't know if you wanted to bring up and show the wounds or have any sort of demo so you can make sure that people understand the different types of wounds that are out there, maybe different techniques depending on the type of wound. You can
this was just actually from the app, just showing people the different types of wounds.
I do want to warn people that if you are sensitive to some disturbing images, this is the time to turn it off because some of the images will be disturbing. It's real life, though. We're talking about medicine. And usually those who are watching this particular series, they're used to it. They have wounds. They've seen them, been there, done that. And I think showing images is a great educational tool. So you can go ahead and you can share your screen. And as I said, look away if you can't stomach to see a little bit of blood.
Yeah, so I don't know if everyone could see it, but just showing in the upper left-hand corner here, these are necrotic wounds. The first two are pressure injuries on somebody's heel. So a lot of times with those, unless the person went to vascular and we knew there was enough blood flow, we would not debride these until we knew there was enough blood flow to heal them. So a lot of times we'll use betadine. We could use a wound cleanser to cleanse those 2 or 3 times a week. And sometimes the healing goes on underneath this like protective shell, and sometimes it comes off on its own. Then we cross that bridge. The one next to it is gangrene. So with that one, we won't even cleanse it. We'll just use betadine to paint the area because it's dry, it's intact, there's no odor, for this particular patient. So we don't want to put moisture on that. And now we soften it, and this could, become malodorous. And next thing there's maggots, and you go down that lane. So that just to give you an example of that. The next, pictures here showing one person with a skin tear on her arm, another person with a malignant wound on her leg. So those are Vaseline gauze. It doesn't stick. These are wounds that are, you want to keep them moist. You don't want anything adhering to it, causing bleeding and pain. So oftentimes we'll use those. And you can see the bottom 2 on that section. That's the lady before, and 2 or 3 weeks later, she healed nicely. Very sensitive skin. She stopped the aspirin because she was like, every time you touched her, she'd bruise, and one wound would heal, another one would open up. So that's why I say we're looking at, okay, this is not draining heavily. What can we put on there? It's not going to stick. It's going to keep it moist, not too moist in those situations.
Make it a little bit bigger.
Make it bigger. Let me see if I could. Oh, I see. I didn't even put the PowerPoint thing.
How do you know when you need to keep a wound wet versus let it dry?
Well, all wounds, basically, if they're open wound, moist wound healing is the way to go. The only exception is the dry gangrene and that black S scar on the person's heel up there. With those, we don't want moisture because we're opening something up that we don't, with the heel, we don't know how much blood flow is there yet. If that person went to vascular and they said, oh yeah, we could restore the blood flow, or the blood flow is okay, then you might think Santel in those situations, but we don't automatically go there. But all these other wounds, basically moist wound healing, not too moist, not too dry, is the way the cells can get across and hopefully heal that wound. Now, the person on the upper right here is a pressure injury on somebody's sacral area on the back, and that's, more draining heavily. So in those wounds, we're looking at alginates, gelling fibers. This is just Medline's brand, but a lot of companies have theirs. So we would use something like that to manage the drainage. So it's keeping it moist, but not too wet. To pack that wound, we put gauze and maybe cover it with a silicone foam. We use skin preps to protect the surrounding skin, because we don't want to forget the peri wound, as we say, because if that gets all moist from all the drainage and everything else, then that's going to slow down the healing. Then just showing the bottom left with debridement techniques. So the first two pictures are a lady I did go to see and debrided that at the bedside. There's a lot of odor, the dead tissue is hanging off there. So no Santel in the world is going to do that, So I did that. Immediately the air cleared because the odor was, as soon as we cleaned it and got the old dressing out of there, it was amazing. So then we, look at what's appropriate for this particular lady. So an alginate, because it was draining heavily. Then the next lady, she had eschar like the one up top on the upper left for a couple of months, and it just sort of did its own thing. Diabetic, Parkinson's, tube fed, and then all of a sudden it started lifting on its own. So the healing was probably going on underneath that for the last 2 months or so. The family called, and now it was draining. They saw on her sock that I was able to go in and debride that because it was hanging off, and then started the honey on her heel, and she went on to completely heal, over time. And then the last lady was somebody, again, with a lot of odor, that we used the Dakin's moistened gauze and in combination with debriding at the bedside. And that's her a couple of months later. You can see the wound is much smaller, the surrounding skin looks good. So, and these are patients on hospice. So, we're seeing amazing results. The ones on the bottom here, I just want to show examples of typical, maybe neuropathic ulcer on the person's foot, because when you're walking, you're putting it on that first metatarsal head, the pressure. This is actually my brother, the one down there, and he's not even diabetic, but he's got neuropathy for other reasons. And he likes to run and all that, didn't have the right footwear. And this thing took a few months to heal. And Yuri had amputation of half of his third toe. So it's due with blood flow, getting the pressure off that. He eventually went on to heal. But the pressure point was what he was missing, because he kept walking on it, and that wasn't helping the situation. And the next person, you could see, had an amputation of the first toe, and now it's an arterial wound on the third toe. So something like that, a little dab of honey would be good there, and good cleansing of the foot and between those toes, and hopefully getting the blood sugar under control and blood flow. And then the last picture here is just an example of somebody that has venous, you see all the swelling, and arterial disease. So she could tolerate a little light compression. We rolled it up just to see the wound. And with her, we had a silver powder we used, because it was draining, moderate, and it was so small you couldn't really put anything else in there, and it worked well for her. Got the swelling down, and she had end stage dementia, so she was confused and she was pulling out the dressing, but that worked for her over time. So we just, looking, what's the size of the wound? Do we need to debride? What are we doing? So it's not just like, what dressing do we use? You got to look at the whole picture.
Fantastic. Thank you so much, Anne. We have a question coming in from Marcia. This is our last question, I think, unless Diana wants to jump in again. But Marcia, go ahead and ask your question about saline.
Yes, I found a product. It's a spray saline. It's called Simply Saline. And reading more closely on the label, I noticed that it also has aloe in it. So how is aloe for wound care treatment?
Yeah, I mean, some people love it. I mean, I think if you're careful that's probably sterilized, but I've had patients, from different cultures that like to use, whether it's turmeric, whatever they have in the house. And listen, it's not going to hurt, but, and they've used aloe for burns or skin tear. It's soothing. So I think that's fine. It probably makes it a little more moist and hopefully less irritating on the tissue.
Fantastic.
Thank you.
Sure. Yeah.
And thank you, Marcia. Thank you, Diana, for jumping in and asking questions. We really appreciate it. And Anne Walsh, you are amazing. Thank you so much for being here and answering our questions every single week and providing such critical education for patients who have these non-healing wounds, whether they're neuropathic, they're from diabetes, or they're from peripheral artery disease, or maybe all of the above. If you have questions about caring for wounds, make sure you go to the App Store or Google Play and download Wound Care Pro. It's just $4.99. And join us every single week. We have Anne who's here. She'll answer your questions. You can email kym@padhelp.org if you want an invite to the live studio audience, or else just check out our YouTube channel at youtube.com/The Way to My Heart and click on live, and you'll see every single upcoming episode of Wound Care Pro with Nurse Practitioner Anne Walsh with all of the different topics. So you can go ahead and join there. Our amazing producer, Joshua, is always monitoring the comments. We'll make sure to get your questions heard and answered by Nurse Practitioner Anne. So thank you, everyone, for joining us. Thank you, Nurse Practitioner Anne. Next week, actually, it's my birthday, September 4th, and we're going to be talking about floaters, which is a really big topic. Why is it important to talk about offloaders?
Well, if the wound is on the foot and you're not getting the pressure off it, it can't heal and it only get worse. So it's critical in those situations.
Yep. So we're going to learn more about offloading shoes and how to choose them, when you need them, when you don't. All of it coming up next week right here on Wound Care Pro. Thanks, everyone, for joining us.
Thanks, everyone. Take
Thank
care.
you.